Hi, my name is Florence. I am the Osteopathic Manual Practitioner here at Proactive Pelvic Health. Today I'm going to show you one of my favorite integration techniques called the cross chains. So right away I'm just going to demonstrate for you. So you're going to lie down on the bed, knees bent, and then find just that crook lying position. Arms come around, grab onto the opposite elbows like I am Jeannie. You're going to take the legs one way and the elbows the other way. Breath in and then exhale to come back to center and then switch. So the legs go one way, the arms go the opposite way. And then if you feel super crazy, you can take the head to follow the legs and then come back to center and switch and come back to center. So what this exercise does is it creates a dissociation between the upper half of the body and the lower half of the body, which is super important for functioning throughout the day to integrate movement after treatment. And it also creates a pivoting or almost a twisting and a rinsing of the liver and the abdominal organs.